In this video of the Kenyan Association of Neuroscience Nurses, we're going to talk about assessing muscle strength. Muscle strength is graded on a scale of 0 to 5. 0 is no detectable muscle contraction and 5 is active movement. This is normal muscle strength. You give a score of 1 if you can feel or see contraction but there's no arm movement. You give a score of 2 if when you remove gravity, and I'll show you how to do that, there's movement of the limb. A score of 3 means they can move their arm or leg against gravity. In other words, they can lift it off the bed, but they can't resist. If they can resist a little bit, and I'm going to show you this, then they get a 4. Again, if they're normal, they get a 5. We start muscle strength grading by having them extend their arm, palm up, and ask them to touch their nose. To further evaluate, we're going to ask the patient to lift each limb off the bed. This is testing against gravity. We look for obvious asymmetry or atrophy. Is there ataxia? Does one arm move faster than the other? In this case, we have a normal patient. Even when we don't see movement, we need to palpate or look very closely. In this case, I'm palpating the tricep muscle to feel if that muscle is contracting, even though the arm is not moving. If you are convinced there's no voluntary movement, apply a pain stimulus. Now let's apply the scoring grid. First, we give a score of 0 if there's no detectable muscle contraction. Note that I am palpating the tricep. A score of 1 is given if you can see or feel muscle contraction. In this case, you can see a little bit of contraction in the flexor carpi ulnaris, which is one of the 3 muscles in the wrist flexor group. It's subtle, but you can see this. I think the easiest way to assess for a grade 2 is to hold the patient's wrist and hand up off the bed and ask them to move their hand towards their body. This means they don't have to fight gravity, they're just moving forward. If the patient can lift their hand, arm, or leg off the bed, that's a score of at least 3. If the patient can lift their arm or leg off the bed and there's a little bit of resistance to gravity, they don't have to fully fight you, but a little resistance to gravity, that's a score of 4. If they have normal muscle strength to their age and gender, they get a score of 5. Remember, you're not grading whether they're stronger than you, you're grading whether or not their muscle strength is normal to their situation. That's how we get a score from 0 to 5 for grading muscle strength. In collaboration with the Kenya Association of Neuroscience Nurses, muscle strength grading scale is based on Chapter 5, the assessment chapter of the American Association of Neuroscience Nurses core curriculum.